Hello, my name is Stephen Malarchick, and I'm a doctoral student in Colorado Mesa University's Doctoral of Nurse Practitioner program. And this is an assignment called Deep Dive. It's a look at a advanced practice nursing question in depth. The question we'll be looking at is, how can the advanced practice nurse practice in areas or with patients that are different from his or her own ethical principles? So let's talk about some of the objectives of this presentation. The first thing we'll do is look at what are ethics. We'll define them. Then we'll identify situations in which an advanced practice nurse might find themselves in an ethical dilemma. We'll discuss ethics as it applies to nursing, medicine and healthcare, and advanced practice nursing. We'll explore what ethical models exist for the APN to use. And then lastly, we'll analyze how to use ethics in providing care as an APN. When we look at the actual definition of ethics, this is a definition from the Merriam-Webster online dictionary. And the first one that's there is the discipline dealing with what is good and bad and with moral duty and obligation. Well, that sounds pretty good. That sounds like something that we could use in the APN. But if you look down in number 2 and part B, this kind of deals directly with what we're speaking about. And that's the principles of conduct governing an individual or a group or professional ethics, also called a guiding philosophy. This is the definition that we will use for this presentation. You may be wondering, what are some of the ethical dilemmas that I might face as an advanced practice nurse? One might be treating patients from the LGBTQ community. These are patients that identify as either lesbian, gay, bisexual, transsexual, or queer, or questioning their sexual identity. One issue could be providing hormones to a person transitioning from one sex to another. Another issue is perhaps this patient's chosen lifestyle conflicts with an APN's own belief system. How will you approach issues surrounding contraception and family planning? Things such as prescribing contraception or long-term contraception, abortion, morning after pills, Plan B, these are all hot-button topics in healthcare today. How will you approach patients who wish not to have their children vaccinated? There are instances of many pediatricians refusing to see patients if they refuse to get vaccinated. How are you going to approach that? How can you ethically approach that situation? How about religious beliefs? How will you address patients who refuse treatment for religious reasons? Perhaps they refuse blood products or ending a life-threatening pregnancy. Some of your patients may be in the country illegally. What are the ethics in treating those types of patients? Mentally ill patients. When do we decide to send them to a mental health professional? How about dangerous patients? What are your feelings about treating dangerous patients such as prisoners? How will you approach caring for somebody that's convicted of murder or perhaps child rape? What about patients that may ask you to order unnecessary exams or tests so that their insurance will cover them? A study by Ulrich et al. From 2014 reported that 40% of NPs and PAs surveyed stated that many patients demand potentially unnecessary tests and treatments. How do you feel about seeing patients who you know will not be able to pay for their care? How about caring for people with STDs? Perhaps you care for their spouse or significant other. What are your obligations for informing them of an STD? How about if you're approached with a minor needing care? Perhaps they don't want their parents to know, or perhaps their parents have forbidden them to get medical care. How will you approach that? What if you make an error? What are the ethics surrounding disclosing those errors to your patient? Some of our care might involve end-of-life care, and there might be ethical dilemmas surrounding that. Many of these ethical dilemmas also involve laws in the municipality or the area of where we're practicing. These are but a mere few of all of the dilemmas that we might face as advanced practice nurses. Let's discuss what ethical code of conducts are. When we look at how they're developed, There's three different methods of doing this. The first one is deontological. This is a rule-based code of conduct. According to Peterson and Potter, this system determines what is good or bad based on one's duty and what that duty requires. Most professional codes of ethical conduct follow the deontological system. Teleological codes of conduct are those that are based on individual or group goals. Healthcare has several general goals. According to Peterson and Potter, one goal is the prevention of disease and promotion of health. Another is to alleviate pain and suffering. A third is to prevent death, or to provide a peaceful death. The last goal is to cure those who are ill, and for those that can't be cured, provide care. The final type of codes of conduct are based on artiological or virtue-based. Peterson and Potter say that many believe that virtue ethics cannot function alone. Virtues are developed in individuals because rules and goals have become part of their character. Virtue is a very tricky concept. It's kind of similar to me as saying beauty is in the eye of the beholder. Virtues are different depending on the person. Many code of conducts actually exist. Nursing has a code of conduct. One of the first nursing code of conducts was, according to Peterson and Potter, developed in 1953 by the International Council of Nurses, and it included the respect of patients' dignity and human rights, which include the rights to life and to be treated with respect. The most recent nursing ethics or code of ethics has been published by the American Nurses Association in 2015, and we'll look at that in just a moment. Physicians also have a medical code of conduct, and that's displayed on their website, and we'll take a look at that. The one group that doesn't have a code of ethics is advanced practice nursing, and in particular nurse practitioners. They don't have a published ethical code of conduct that I could find. Most nurse practitioners fall back on the ANA's code of ethics and use that as a guide. But we will talk about one that Peterson and Potter developed and recommended in 2004 for use by nurse practitioners. If you think about it, it is important for advanced practice nursing to have their own code of ethics, and that's because although we are nurses, we provide care that is advanced from regular nursing care, and we do provide care that's different from physician medical care. So we do need our own unique code of ethics. This is the code of ethics for nurses, copied from the ANA website. If you would like, pause the video here and look over these 9 provisions provided by the American Nurses Association. This is the AMA Code of Medical Ethics for physicians. As you can see, there is a big difference between the nursing code of ethics and the AMA physician code of ethics. Really, a nurse practitioner code of ethics should be some blend of both of these codes of ethics. Pause the video and look over these principles of medical ethics provided to physicians by the American Medical Association. Potter proposed that a code of ethics for nurse practitioners should be based on an equilibrium of goals ethics, rules ethics, and roles ethics, which the author described as the same as virtue ethics. The ethical principles are based on the AANP standards of practice for nurse practitioners. Peterson and Potter stated, "To establish an ethical code for the profession, we first sought to determine the scope of practice for the profession of NP." This illustration is the framework of Potter's multidimensional ethical decision-making tool. Let's look at the code of ethics for nurse practitioners that Peterson and Potter proposed. The first one is the nurse practitioner should provide competent medical and nursing care with compassion, confidentiality, and respect for the individual, regardless of social, economic, or health status. The second is the NP's primary commitment and responsibility is to the patient, whether that patient is an individual, family, group, or community. The NP shall support access to care for all patients and should strive to affect public policies that will result in equal access. Number 4, the NP shall support the patient's efforts towards an optimal level of health through education, self-care promotion, consultation, and collaboration with other healthcare team members. Number 6, the NP shall maintain and be accountable for accurate medical records for each patient. The NP shall not engage in fraud or deception and shall report any other healthcare provider that engages in such activities. 7, the NP shall advocate for and strive to protect the rights, health, safety, and privacy of all patients. The NP should collaborate with other professionals and the public on local, national, and international levels to promote this effort. Number 8, the NP shall continue to advance personal and professional development through practice, education of the public, and lifelong continuous study, research, and activity in professional organizations. And number 9, the final one, the NP shall, in the provision of patient care, responsibly choose whom to serve, with whom to associate, and the environment in which to provide that care. When we look at this code of ethics, we can see the blending of the medical code of ethics and the nursing code of ethics. Whenever we approach an ethical dilemma, we should try and keep a code of ethics in mind. You might be wondering, what role does the individual nurse practitioner's conscience play in these type of decisions? Interesting, Peterson and Potter stated, the individual conscience is not the final arbiter in a moral decision. The group with which the individual practitioner identifies is the arbiter of what proper conduct should be. This is in contrast to an article by Labs that found through survey that one of the threats to practicing with integrity is not being able to practice according to the NP's conscience. Labs stated factors in the work environment that the NPs most often mentioned as threats to practicing moral integrity were the right of health professionals to practice according to their conscience. It is up to the individual nurse practitioner, based on what they believe, what they've studied, and reflecting on it, what role the conscience will play in their approach to ethics. In Lab's survey of nurse practitioners, they identified 4 threats to moral integrity. They were time constraints, pressure to meet productivity quotas, lack of respect for differences in beliefs among health professionals, the right of health professionals to practice according to their conscience, and the constraints within the wider health system. From the survey, Labs came up with 5 phases that evaluate the threats to moral integrity or ethics. Phase 1 involves encountering the conflict. This is the encounter that creates the conflict between the nurse practitioner's beliefs or values and the ethical dilemma that the patient, employer, or some other stakeholder presented. Then there's drawing a line. In this phase, the NP determines what they are and are not willing to do, and yet still be ethical or maintain their integrity. The third phase is finding a way without crossing the line. The nurse practitioner tries to determine a way to solve the ethical dilemma while not crossing their own line and following their own ethical code. Finally, we need to be reflective. We need to evaluate the actions. How did it turn out? Did the NP compromise or not? What could be done differently next time if presented with a similar challenge? In summary, we have defined ethics as the principles of conduct governing an individual or group. That was from Merriam-Webster. We discussed codes of ethics, and we looked at the existing codes from the American Nurses Association and the American Medical Association. We discussed the proposed Nurse Practitioner Code of Ethics, as presented by Peterson and Potter's proposed Code of Nurse Practitioner Ethics. We discussed using 4 phases to evaluate a threat to an NP's moral integrity and ethics. Finally, choose a scenario from the D2L posting to evaluate how to handle the ethical dilemma using a chosen code of ethics and explain your reasoning. Thanks.